Imagine a pain so intense that it brings your daily routine to an abrupt halt, a pain that comes without warning and feels like nothing you've ever experienced before. What if this agony could be traced back to tiny crystals forming silently inside your body, crystals that could have been prevented? Stay with us as we delve deep into the hidden world of kidney stones, a condition affecting 1 in 10 people globally. We'll explore how these tiny stones cause such immense pain, uncover practical steps you can take to prevent them, and reveal natural remedies that could help you avoid this excruciating experience. Welcome to Health Haven, your trusted sanctuary for wellness insights and health education. If you're new to our community, consider subscribing and hitting the notification bell. We're here to empower you with knowledge to lead a healthier, happier life. Let's embark on our journey by understanding what kidney stones are and how they form. Your kidneys are remarkable organs responsible for filtering waste products and excess fluids from your blood, producing urine in the process. But sometimes, minerals and salts in the urine crystallize, forming hard deposits known as kidney stones. Kidney stones, medically termed nephrolithiasis or renal calculi, are solid masses made of tiny crystals. While they can vary in size, from as small as a grain of sand to as large as a golf ball, their impact on your body can be significant. These stones can lodge in any part of the urinary tract, causing severe pain, blockage of urine flow, and potential infection. To better understand how these stones form, consider your urine as a solution containing various dissolved minerals and salts. Under normal circumstances, substances in the urine prevent or inhibit the formation of crystals. However, when your urine becomes highly concentrated, due to inadequate fluid intake, for example, the balance shifts. High levels of certain substances like calcium, oxalate, and uric acid can lead to the formation of crystals that grow into stones. Think of it like making rock candy. When you dissolve sugar in water and then let the water evaporate, sugar crystals start to form as the solution becomes supersaturated. Similarly, when there's too little liquid and too much waste in your urine, crystals begin to form. Over time, these crystals may combine to form a larger stone. It's essential to know that not all kidney stones are created equal. Identifying the type of stone you have can help determine the cause and guide preventive measures. The 4 main types are calcium stones. These are the most common, accounting for about 80% of all kidney stones. They are often formed from calcium oxalate. Oxalate is a substance found in certain foods like spinach, rhubarb, nuts, and chocolate. Factors such as high doses of vitamin D, intestinal bypass surgery, and several metabolic disorders can increase the concentration of calcium or oxalate in urine. Struvite stones. These stones form in response to an infection, such as a urinary tract infection, UTI. They can grow quickly and become quite large, sometimes with few symptoms or little warning. Uric acid stones. These form in people who lose too much fluid due to chronic diarrhea or malabsorption, eat a high-protein diet, or have diabetes or metabolic syndrome. Genetics may also play a role. Cystine stones. These are rare and occur in people with a hereditary disorder called cystinuria, which causes the kidneys to excrete too much of certain amino acids. Several factors can increase your risk of developing kidney stones. Dehydration. Not drinking enough water each day can increase your risk, as it leads to less urine production, making urine more concentrated and less able to dissolve urine salts. Dietary factors. High intake of protein, sodium, salt, and sugar can increase your risk. High sodium intake increases the amount of calcium your kidneys must filter, thereby increasing the risk of kidney stones. Obesity. High body mass index, BMI, large waist size, and weight gain have been linked to an increased risk of kidney stones. Digestive diseases and surgery. Gastric bypass surgery, inflammatory bowel disease, or chronic diarrhea can cause changes in the digestive process that affect the absorption of calcium and water, increasing the levels of stone-forming substances in your urine. Family or personal history. If someone in your family has had kidney stones, you're more likely to develop them too. If you've already had 1 or more kidney stones, you're at increased risk of developing another. Certain supplements and medications. Overuse of vitamin C, dietary supplements, laxatives, when used excessively, antacids based on calcium, and certain medications can increase your risk. Kidney stones may not cause symptoms until they move within your kidney or pass into your ureter, the tube connecting the kidney and bladder. When that happens, you may experience severe pain, Sharp, cramping pain in the back and side, often moving to the lower abdomen or groin. This pain can come in waves and fluctuate in intensity. Painful urination, a burning sensation when urinating. Hematuria, pink, red, or brown urine due to blood in the urine. Nausea and vomiting, often accompanying severe pain. Frequent urination, an urgent and persistent need to urinate. Fever and chills, indicating an infection, which can be serious and requires immediate medical attention. If you experience any of these symptoms, it's crucial to seek medical attention promptly, as kidney stones can lead to complications if left untreated. Upon visiting a healthcare professional, several diagnostic tests may be conducted. Imaging tests, such as abdominal X-rays, CT scans, or ultrasounds to visualize the stones. Urine testing, a 24-hour urine collection may detect high levels of stone-forming minerals or too few stone-preventing substances. Blood tests, to check for high levels of calcium or uric acid in your blood. Stone analysis. If you've passed a stone, analyzing it can help determine what type it is and guide prevention. Now, let's focus on prevention, because when it comes to kidney stones, prevention is indeed better than cure. Stay hydrated. The most effective step you can take is to drink plenty of fluids, especially water. Aim for at least 2 to 3 liters per day, or enough to produce about 2 liters of urine daily. Adequate hydration dilutes substances in urine that lead to stones. 2. Dietary modifications. Limit sodium intake. High sodium levels can increase calcium in your urine. The recommended daily sodium intake is no more than 2,300 milligrams. If you're at risk for kidney stones, your doctor may advise you to limit sodium to 1,500 milligrams per day. Reduce oxalate-rich foods. If you tend to form calcium oxalate stones, limit foods high in oxalate like spinach, beets, Swiss chard, sweet potatoes, nuts, tea, chocolate, and soy products. Consume adequate calcium. Contrary to what you might think, don't reduce calcium intake drastically. Instead, consume the recommended amount of calcium, preferably from dietary sources like milk, yogurt, and cheese. Low calcium intake can increase oxalate levels and lead to kidney stones. Moderate protein consumption. High intake of animal protein can increase the risk of kidney stones. Limit your consumption of red meat, poultry, eggs, and seafood. Opt for plant-based proteins like beans, lentils, and tofu when possible. Increase citrus intake. Foods like lemons, limes, and oranges contain citrate, which can help prevent stone formation. Adding lemon or lime juice to your water can be beneficial. 3. Maintain a healthy weight. Obesity can alter the acid levels in the urine, leading to stone formation. Regular exercise and a balanced diet can help manage weight effectively. 4. Limit sugar and fructose. High sugar intake can increase the risk of stones. Be cautious with sugary drinks, sodas, and processed foods high in fructose corn syrup. 5. Monitor oxalate and calcium intake together. Consuming calcium-rich foods and oxalate-rich foods together during a meal can help them bind in the gut before reaching the kidneys, reducing the risk of stones. If kidney stones are small, they may pass on their own with adequate hydration and pain management. However, larger stones may require medical intervention. Medication. Alpha blockers can relax the muscles in your ureter, helping you pass the stone more quickly and with less pain. Extracorporeal shockwave lithotripsy, ESWL. This non-invasive procedure uses shock waves to break up stones into smaller pieces that can be passed in the urine. Ureteroscopy. A thin scope is inserted into the urethra and bladder to locate and remove the stone or break it into pieces. Percutaneous nephrolithotomy. Surgical removal of very large stones through a small incision in your back. Your doctor will recommend the best treatment based on the size and type of stone and your overall health. Kidney stones may be small, but their impact can be profound. The good news is that with the right knowledge and proactive steps, you can significantly reduce your risk. Simple lifestyle changes, like staying hydrated, adjusting your diet, and being mindful of natural remedies, can make a substantial difference in your kidney health. Thank you for joining us on this informative journey at Health Haven. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more valuable health insights and wellness tips. Until next time, take care of yourself, stay hydrated, And remember that small changes can lead to significant improvements in your health.